Plans are underway to tap the community to help residents with mental health issues. More could benefit if their symptoms are picked up early. 10 more estates will come under a multi-agency community support network by year-end. There will also be more community teams to support the elderly with dementia and depression in the central and western part of Singapore. In this week's Spotlight, Sarah Gross takes a look at these ground-up efforts.
It's 8:30 p.m. and these group of volunteers are preparing for their weekly house visits. They come from all walks of life, be it civil engineers, architects, students or retirees. But they have banded together tonight to help residents in the Kembangan Chai Chee estate who may suffer from mental illnesses. The area is one of the constituencies where a local community support network has been established. The support network is a collaborative effort between government agencies, healthcare institutions, grassroots and community partners. Now they work together to identify healthcare needs of residents within each neighborhood and refer cases if necessary. Now it's hoped that this network can raise awareness on mental health issues within the community so that at-risk residents can be better supported.
The prominence of the team going around the blocks, door to door, block to block, combing the areas itself, bring the awareness to the resident around, and a lot of it is through by words of mouth. The resident surveys the information to us that certain family or certain unit of this block may need your assistance, may need the team to come in.
Since 2013, over 50 residents have been helped in this estate. The volunteers are trained to identify various kinds of mental illnesses. The Institute of Mental Health is one place where they are given this support. The Institute provides basic and skills-based training to grassroots leaders and volunteers on how to communicate and manage a person who may be aggressive or suicidal.
The training is to equip them with better understanding and also a skill set to address some of these concerns. We do not want them to be treating them, after all they are grassroots. So their role is to identify and make the necessary referral, maybe by encouraging the family members, as in the resident, the family members, so that the person identified can get help earlier.
To make the process easier, community partners of the local community support network can call IMH's helpline once they identify a resident who needs assistance. So far, more than 20 constituencies have joined the network. By 2017, there are plans to engage 50 areas, with 10 coming on board by the end of 2015. These include Hong Kah North, Tanjong Pagar Tiong Bahru, Marsiling, Teck Ghee and Tampines. The estates are likely to have a higher concentration of elderly.
One of the greatest challenges would of course be to persuade some of these residents, together maybe with their caregivers or family, to be supported and to seek treatment. Another challenge that we have found would be in communication and in sharing of information across the different stakeholders. I think that can be improved, and the local community support network is really one useful platform to enhance communication and sharing of information among the different agencies. So when a case is surfaced, they are aware of the case, they can discuss as to how best to address and manage the case.
The government is also beefing up community support for residents facing dementia and depression. Since 2012, Community Resource Engagement and Support, or CRESS teams, have been embedded in several estates to link residents to the appropriate mental health care networks. There are now 8 CRESS teams, and by 2017, the government hopes to triple this number to 24, with 10 CRESS teams set up by end 2015. Senior social worker Mark Lin is in charge of the CRESS team located at Marine Parade, where he conducts monthly house visits.
Hey, how have you been? Yeah.
During his visits, he typically asks seniors a series of questions, such as whether they can remember their home address or if they are able to count backwards easily. Their emotional state is also assessed. If the resident is identified as being at risk of dementia or depression, Mr. Lin will refer him to a hospital or to relevant counseling services.
It becomes less, less daunting for them to like, okay, maybe I might need help, but I don't think I want to take such a big step to go to the institution and get antidepressant or whatnot. But I would like to just first understand about myself a little bit better. Then if I really cannot cope, at least I know that someone is there for me to link. At least they can help me to navigate the system so that I can get the resources or assistance that I need.
Going forward, the community outreach team here hopes to be able to expand its scope of identifying other psychiatric disorders such as schizophrenia or even hoarding behavior. It also hopes to strengthen its intervention methods by collaborating with other partners. Beyond support for mental health, there have also been efforts to raise awareness on preventive health. 70-year-old Madam Wang Huanhua recently enrolled in a wellness program in her neighborhood. She attends health talks and also learns how to cook food which can help lower her high blood pressure.
我通常都是在家里煮那些粥啦，健康的东西，吃菜啦，吃燕麦啦这些东西，吃鱼啦。我没有乱外面吃东西，所以外面那些油啊什么我没有吃这些东西。所以我的血压在检查的时候，他每次都说我的血压很好。
The wellness program is part of a partnership between the National Healthcare Group Polyclinics and grassroots organizations of Nee Soon South constituency to provide services such as dietetics and clinical diagnosis to the elderly. The polyclinics regularly engage grassroots and community partners to understand and identify the health needs of residents. The initiative has helped to reduce reliance on the acute care sector.
To have a patient coming in who is engaged about taking care of his own health and who is very much aware of what his health needs are and is proactive and empowered to do the right thing and has the knowledge of what health promotion is all about. When he steps foot in the polyclinic or in the hospital, you already have half your battle won because he comes in well informed, and it will actually help reduce our attendances.
At the end of the day, healthcare professionals agree that a ground-up effort is needed to improve the health of residents. They say that relying solely on the government and social service agencies is not enough, as the grassroots organizations, neighbors and caregivers are needed to access the community. Only then can the community effort be truly sustainable.